a little bit about, they've asked me to talk to you guys about drugs and the danger of it. So how do you guys think drugs work? Please unmute yourself. I want to hear what you're saying. How does drugs work?
I guess, his name is Matthias. I guess drugs work in.
Okay, I think it's going to be difficult to unmute yourself, so I'll just talk. Drugs works on the dopaminergic system, and most drugs work in the same thing, in the same area, and it works repeatedly on that system until the receptors are burned out. So I want to play you guys an actual clip from Oxford University. So it is quite a, can I screen share, please? It's quite an interesting one. Hi, Gareth. Okay, if you guys can just get me to screen share. Hi, Cheryl. Can I screen share? Thanks. So I want to start out with showing to you how it works. Now, the big thing about this screenshot is it talks about opioids, but opioids is not the only thing that works on the system. So put your drug in there. Don't think, I'm using alcohol, it's not in there. Put your drug in here so that we can have a look.
This is Susan. Susan loves to bike. While out for a ride, she falls and breaks her arm. Special cells called neurons send a signal through the spinal cord to the brain, which interprets the signal as pain. Susan understands the pain means she needs to go to the hospital, and her body is equipped for survival, helping her not to panic so she can seek help. Many of her neurons are covered in proteins called opioid receptors. These receptors act like a brake to slow down the neuron's ability to send pain signals. When injured, her body releases natural painkillers called endorphins. Like a key in a lock, endorphins activate opioid receptors, slowing down the pain signal and preventing a panic. Susan gets treated for the broken bone, but 3 months later, her arm still hurts. And now that pain is making her feel depressed and anxious. So her doctor prescribes an opioid painkiller. There are many different opioids, but they all share a chemical similarity to our own endorphins. This allows them to bind to the same opioid receptors and stop pain signals. But that's not all they do. Deep inside Susan's brain is a region called the Ventral Tegmental area, or VTA for short. The VTA is full of neurons that produce a chemical called dopamine. When something good happens, dopamine is released, giving Susan a feeling of pleasure. This helps teach her brain to keep seeking out good things. To keep dopamine neurons in check, inhibitory neurons keep the brakes on until something good comes along. Just like the pain neuron, these neurons are covered in opioid receptors. When Susan takes the painkiller prescribed by her doctor, the opioid receptors turn off the inhibitory neurons and release the brake on the dopamine neurons. The rush of dopamine temporarily eliminates Susan's depression and anxiety, and she feels relief, calmness, and even euphoria. As Susan continues to take the painkillers, her brain responds by trying to regain its balance. Her inhibitory neurons work extra hard, even when the opioid receptors are activated, and it becomes harder and harder for her dopamine neurons to release dopamine. Susan finds that she needs to increase her dose of painkillers in order to feel comfortable. This is called tolerance. Eventually, Susan's pills run out. Inhibitory neurons that had been working overtime are let loose, clamping down on those dopamine neurons and shutting them off almost completely. Now, not only is Susan in pain, but the depression and anxiety come back. On top of that, Susan feels ravaged by an inescapable physical sickness far worse than any flu. Susan's body is going through withdrawal. Most people who take opioids for a long time tend to experience some withdrawal, but they can still stop taking the pills and return to normal. But for people like Susan, it's not so easy. Her genetics and the environment she grew up in put her at a higher risk for addiction. Her withdrawal symptoms aren't just unpleasant, they're unbearable. Susan thinks the only way to feel normal is to find more opioids. And this is how the cycle of opioid addiction emerges, driven by a brain trying to regain its balance. But there is hope for Susan. Though the road to recovery can be challenging and there may be setbacks, treatment can retrain Susan's brain. With the help of medication and therapy, Susan finds pleasure in her life once again.
The big thing is that it may look like it's only opioids that works this way, but everything works this way, including cannabis, pornography. All is into the dopaminergic receptors. And if you use too much and you get too much, they are starting to block and they slow down. And nothing you do will ever give you that first rush again. And people talk about that. But we always think there's one drug that's better than the others. I'm wondering if you guys know what is the worst drug of all drugs. If we look at bad drugs or good drugs, we look at morbidity and mortality. So how many people die from the drug and how many people has a negative influence on their lives according to the drugs. And everybody always says, yeah, heroin. No, guys, it's alcohol. Heroin is second, and then it's tobacco, and then it goes on. And dagga is quite high up on this list because the morbidity it can cause is quite high. It doesn't cause a lot of people to die, but it does cause a lot of people to lose their lives. And hear me out, heroin isn't just heroin, that includes painkillers. So painkillers is up there with one of the worst drugs that you can use. So all those codeine you use, etc., it's one of the worst drugs you can use. Do not think that that is a baby drug, because it's not. There is no such thing as a baby drug. So why is dagga so important? I'm going to show you guys another photo. In my spare time, which I don't have, I do something called TMS, transcranial magnetic stimulation. And that is, we're looking at the brains and we do something called a PET scan, which is we're looking at the connections of the brain to other areas. And this is how a normal brain should probably look. There's quite a lot of connections. Each one of these we measure. So we like a roadmap. We measure from the one end to the other end, how many connections is there. Some of the connections is blue because they're dopaminergic, or red and they're quite heavily trafficked. The blue is not dopaminergic, it's because it's used quite often. So it's part of the brain that's very often used. And we put the brains on parcellations. So every little block on this brain is connected to another block on the brain. And that is how our brains work. I want to show you in a PET scan what does dagga look like. Remember, the more active your brain is, the worse it is. The worse it is. So lots of activity causes you that you can't think. You need a little activity so that you can think better. So the top one, this is of a dagga addict that has smoked. They've asked her to stop 12 hours before, and then she smoked. So after 1.5 minutes, you can see there's a little bit of a increased activity, which is what we don't want. After 31 minutes, the activity even worse. And you can clearly see after 43 minutes how bad the activity is. And this, guys, is dagga. This isn't even one of the what you say heavy drugs is. Dagga is about 5th out of all the drugs. So it's alcohol, heroin, tobacco, cocaine, dagga, and then the rest goes. Oh, and benzos is after dagga. But you can see here that increased activity, that's damaging. And if you continue doing that for a long time, that area stops working as normal. So we see that in drug abuse that people are seriously using and damaging their brains. One of you asked me, have I damaged my brain? Yes, you have. Just by using, you have decreased the chance of living to your old age without dementia. Drugs cause dementia. We can't say that you're going to get dementia in 2 years' time. What we can say is if you use dagga, you have a 30% higher chance of having dementia at the age of 70. So 70 sounds far away, you know, but it's quickly. Tell me, I feel like 19 the other day, and I'm midway to 70. So you do damage your brain. So what is the big damages that all the drugs do? So let's start at heroin. Heroin stops the dopamine, like all of them. It also stops some of your opioid receptors, and it can cause quite a bit of sedation, which then cause brain damage. And it can cause numerous other side effects. So let's talk a bit about alcohol. Alcohol's mortality is quite high, hey? Because every person that drives on the road and have an accident, that's an alcohol mortality. We know it's quite high. We've seen it now with COVID. If we stop alcohol sales, the admissions to ICUs half or even quarter. I just want to close this. So it even quarters the amount of admissions. So most people that die from car accidents is due to alcohol. And it's not you that drink it. It can be anyone on the road that drinks it, walking or driving. What is the reason for tobacco? Tobacco is often lung cancer and COPD, where you can't breathe anymore, where you need oxygen. And you've got a high percentage of it. Oxygen, the COPD with tobacco is about 50%. If you thought that dagga would skip that, that's nonsense. COPD with dagga is 30%. So no, it's not as bad as cigarettes, but it's definitely not good. 30% of people that smoke dagga on a regular basis is going to have COPD. They're going to have to need oxygen to survive. They will have pumps, they'll die early, their lung function goes down. Then you look at, I skipped to dagga from tobacco, but tobacco is also secondary smoking. So it's people around you that smoke. South Africa has quite strict rules and regulations to try to get that done. That's why we can't smoke in restaurants, etc., or only in smoking areas. Then we can look at crack cocaine. You know, guys know the detail of that. Let's start at the sexual transmitted diseases that you get with that, the risk for sepsis, your brain that goes down, because all of these causes brain damage. There's two of them that do not cause brain damage, and that is mushrooms and LSD. They are the only two that has been proven not to cause brain damage. Every other drug that you can think of that you use, including the dagga, causes brain damage. And remember, some of them causes more. So I must say alcohol causes the worst. We get a syndrome called Wernicke-Korsakoff, which is the severity of alcohol's brain damage, where people have difficulty walking and they can't remember and they can't make decisions. And I must say, of all the people that comes in with alcohol, we try to turn it around with thiamine. So we give them vitamin. That's the cause of Korsakoff's to people with alcohol, and they have to keep on taking the vitamin for the rest of their lives. But we try and stop it, but we can't always stop it. And every single patient that has come in this last year with alcohol have some brain damage. And yes, sometimes we're lucky enough to turn it around with thiamine, and sometimes we're not. But I have not seen an alcohol patient comes in to changes that we didn't have to treat that for. The big thing with DAGA is DAGA has about 120 cannabinoids. You know, tetra, all of them together. If we look at them, only about 5 of them is problematic. 2 of them can cause depression, 1 causes amotivational, and 2 causes psychosis. So I can smoke DAGA for a very long time and stay healthy. Or I can smoke my first Zol and get psychotic. If you looked at DAGA for the long term, the studies that said how safe it is was mainly done in the 70s and 80s. And on average, cannabinoid Zol contained about 120 to 150 cannabinoids. Now, if you smoke a Zol, they contain 150,000 to 250,000 cannabinoids. That means a cup of coffee won't kill you, but do you guys think 100,000 cups of coffee will kill you, the amount of caffeine? That's the difference of DAGA, what you're getting. Is you're getting this huge amount of cannabinoids. No brain is supposed to work with that. What happens? If you are susceptible to the DAGA, you will get psychotic. I worked in Sterkfontein, and in Sterkfontein, you admit about 20 patients a day. Of that 20 patients, Gareth?
Sorry, am I on here? Hang on.
Okay. I worked in Sterkfontein, and about 20 of the patients, we admitted 20 patients a day, of which between 15 and 18 was due to DAGA. They all had psychosis, and what do you guys think happens with them? They're often there for 3 to 6 months in the wards. The doctors see them once a month, once every 2 weeks. They get high dosages of medication, and then in 6 months, when they're better, they get kicked out without any proper treatment. And that is what happens if you're psychotic. If you're so psychotic that you are dangerous, you get sent to a government hospital because we can't manage you in private. And then you might end up in Sterkfontein for 6 months. I spoke to a lot of psychiatrists. A lot of them said they'll try some of the drugs, especially mushrooms and so on. None of them will try DAGA. Not one psychiatrist I know will try DAGA. We are all scared because we know how much of a disaster it is in people's lives. That if I go psychotic now, I lose everything in my life. And I end up 6 months in a rehab or in a Sterkfontein or wherever. And a rehab is the better one of the choices because Sterkfontein is pretty bad. And that is what DAGA does to you, is a long-term problem. It's always interesting for me to look at those slides about how much damage it is, because you don't notice the damage immediately. You feel fine. People around you often see it first, but you often only see it in your 40s and 50s. So the people that come to me in their 40s and 50s and have used DAGA when they were young, they're the ones that we have problem with their memory, problem with their thought processes. And we have to try to sort out something which we probably can't fix because they have the brain damage. So is there any questions? Because then I can talk around questions. I have to tell you, there's a few researchers out that said riding horses is more dangerous than using mushrooms. which is probably true. But there's a lot of research that says dagga is more dangerous than using alcohol. And I don't think so. I think alcohol is the top drug, but there's lots of research that says different. And it's an interesting way of looking at things, that it's not about how you feel now, it's how you feel in future. What's going to happen to your brain in future? I sit with a lot of people at the TMS with those brain things. But I'll tell you a little bit about that just because I'm interested. And it's my current hobby that I do when I have spare time, which I don't have. That these maps is like a map of Joburg, where people drive from Sandton to Melville, and people drive from Hillbrow to Melville, and they drive from Melville to Krugersdorp. So this is the map like that. And the traffic, in order to think the quickest, or to drive the quickest from Sandton to Krugersdorp, there should be no traffic there. So you want a quiet brain to do that driving. Dagga makes that brain unquiet, makes that brain full of traffic. And that's the big problem. You can still reach from Sandton to Krugersdorp, you'll still get there. It's going to take you a lot longer. And that we call processing speed. And that we almost always pick up as a problem. If Danny do those tests, processing speed is almost always there. And it's because there's too much traffic in your brain. So yeah, this is like showing the extra traffic that's not there. And it's showing that at this stage, this lady is 27, her brain doesn't show any damage yet. But I'm telling you, an older patient does. And you have a bigger chance of dementia. And it's interesting, I've got a bigger chance of dementia because I've got epilepsy. If I don't drink my medication, I can guarantee you by the age of 55, I'll have dementia. So I take my medication every single day because I don't want to be at 55 and have dementia. And that's the thing that some of the medication do. The medication often protects your brain. So there's some medication that's specifically for protection, and they are like the Inner or Brintellix or Lamictal or Seroquel. So often we put people on the same medication, but it's because those medication is the only ones that has proven to stop the dementia from when you get older, to help with the traffic when you get older. Because that's it, you know, we need to start protecting your brain so that it can keep working. And at this stage, it's not really working that well, most of you. Most of you have a lot of traffic there. And the more traffic you have, the bigger the problem, long term. Okay, now I better start having questions.
Yeah, hi, Dr. Thea.
Yes.
This is Brian from the farm. I have a couple of questions from clients here. Your name and the question.
Hey, Dr. Thea, it's Ernst.
Hi, Ernst.
I just wanted to ask, with benzo abuse, we watched the video here in secondary and it says it's likely that you could get Alzheimer's with dementia, probably. It's quite likely. I just wanted to know, with 2 years worth of abuse, roughly, or how many years worth of
6
abuse,
months.
what's the probability? 6 months,
6 months
abuse.
You have
all it
the
requires.
probability. Okay, but here's the thing. It requires 6 months to increase the amount. But here's something to get your head around. Normal people without any reason, 50% of us will have dementia by the age of 80. 50% of us. If you reach the ripe age of 92, you won't get it anymore. But 50% of us will have it by the age of 80. If you use substances, it increases. And specific with benzos, it increased to 60%. So 10% bigger chance than normal with benzos. But it increased the longer you're on it. But the studies is on 6 months.
Okay, thanks. Share your name first, huh?
Hi, Dr. Thea, it's Kimberly.
Hi, Kim.
I just wanted to ask, psychosis, does our medication help reverse it, or does it protect or numb it?
Psychosis is a difficult one, and the underlying causes of psychosis cannot be treated by medication. They're only treated by time, but the actual symptoms are treated. And
Okay.
psychosis is damaging to the brain. But again, you know, I start using the Lamictal, the Seroquel, the L5 tetrahydrofolate, which is the vitamin that you guys all on, the Stella Mama that you laugh at. Those are all things that helps protect your brain so that you don't have that much damage. But every psychotic episode does damage your brain. You don't get away scot-free. It's like every seizure, every epileptic seizure I get damage my brain. That's why I cannot take the risk of not taking my meds. If you're psychotic, you cannot take the risk of not taking your meds because it will damage you every single time.
Thank you.
Is that it, guys?
We spoke about DMT.
Yeah, DMT.
Hey, Dr. Thea, it's Adams again.
Yes.
I had a chat with Brian not too long ago, and I was in his office, and we Googled whether or not DMT can give you psychosis. He wanted to prove it to me. And he said the probability is not there. But can DMT cause brain damage?
Yes, it can. Yes, it can. The only ones that we think doesn't cause, but we think it changed the brain function, is ketamine and mushrooms. The rest can all cause damage. But we think those two changes brain function. So we don't know if it changes it positive or negative. Some of the people say positive, some say negative. But then again, you have to be very specific with dosage. But the rest all can cause.
Yeah, I was just wondering because DMT is also psychedelic like mushrooms and LSD. That's why.
I know, but it is a specific type of mushrooms. It's not just all of them. But DMT specific can cause brain damage. The type of mushroom, just for interest's sake, that does not cause brain damage, only grows in one valley in the Amazon, and only the Yale guys knows where that valley is. So it isn't just even the mushrooms you buy on the street that doesn't cause brain damage. It's that one that they have there. And they could only find it in one valley and a few plants, and they making a synthetic medication from it. But that's the only one that doesn't cause brain damage.
Hi, Dr. T, it's Rebecca.
Hi, Rebecca.
I just wanted to find out what if DMT damages our brain, why does it get released when we're born and when we die? Is it only small doses that can't damage our brain?
It's not exactly DMT that gets, it is something similar. So they say it's a bioequivalent that gets released in your brain. So it's not the actual DMT. And it's very similar to the cannabinoids. There is endocannabinoids, so it's cannabinoids that's naturally in our brain that doesn't cause brain damage. They look different from the cannabinoids out of the plant. And it's something very similar to that.
Thank you.
Hi, Dr. Thea.
Hello.
It's Pimelo here. I just wanted to ask, did you say that marijuana, the cannabinoids, they get more and more every single year?
The people grow stronger and stronger plants, so they get more. They are stronger now. So now at about 120, there is some people that are starting to grow to make them less potent. So there is a group that's starting to make less potent, but it's still, you know, in the 60s, 70s and 80s, it was 120 per zol. Now it goes up to 120,000 per zol. So although they're starting to grow plants that has less cannabinoids, it's not close to what it was in the 70s and 80s.
Hi, Dr. Thea. How are you?
Fine, and you?
Good. It's Merwe here. Quick question. What period of alcohol abuse causes non-reversible damage?
Non-reversible.
And
It
how does
is the British research showed that if you take they did the research initially on how much before there's damage. So they figured out that if you take for a man 7 and for a woman 5 units a week, they realized that there's damage on that. So it was a huge study. It involved millions of people. So then they did the people that took less, and they studied them, and they looked at them per week. And it was the people that took 5 and 3 units for a woman and 5 units for a man per week. Where does the problem lie? And they saw that doesn't cause dementia. So the next area of the study was, let's have a look at that amount and see if it's caused something minor cognitive deficit. So it's not dementia, it's minor cognitive deficit. And they figured when they did those tests, everybody got damaged on 5 and 3. So although they don't have full-blown dementia, they do have a problem when they think about stuff and with their IQs. And that was on 3 and 5 a week. And they did it on 8 years of using or drinking. So it was 8 years, and those people already had difficulty. So then they did a study to see how quickly people get sick. And that was on the 7 and the 5 one. So it wasn't on the smaller one, it was on 7 for men, 5 for women. And it was 3 years when the first problem started. And that's on 5 and 3, on 7 and 5, and that is not if you take more than that a week. If you take more than that a week, it starts earlier. We do know that severe alcohol abuse within 6 months can cause a problem. You have to be on the thiamine, that is the vitamin that is the problem. You have to be on thiamine for 6 months for every year that you've been using or drinking.
Thank you, Dr. Thea.
And thiamine does change it around and just improve a lot. Thiamine does, but we don't know how much is. And remember, this is very individual, né? I've had people that drank for a lot of times and doesn't have that much problems. But I have people that drank for a few months and have a huge amount of problems. It depends on your own genetics behind it.
Hey, Dr. Thea, it's Ernst again. Another question with benzos. We watched this other video that they showed us here primary, and also said a decrease in cognitive performance with benzo abuse. But then also, like, what I've personally experienced, I never had an anxiety problem until I abused benzos and got off of them. That's when it's like came in hard. And I wanted to know, can your brain fully recover from benzo abuse, and will the anxiety ever like go away, and will my brain like get better to like back to normal?
I don't know. I hope. I don't know. The anxiety that you get from abuse of any substance, you see, I actually just spoke about the bad ones, you know, what will make you die and what will take your cognition away. I did not speak about the things like depression that DAGA can cause, and you can have such a demotivational depression that you can sit at home for a year, not willing to go out, go to school, do anything else, to sit at home. I did not talk about the benzos that can trigger an anxiety disorder, or DAGA that can trigger depression, or alcohol that can trigger anxiety and depression. The problem comes here. Once an illness like depression or anxiety is triggered, you have it. You can learn to manage it. You can learn to manage it sometimes off medication, or you can learn to manage it with medication, but that illness has been triggered. So Ernst, your anxiety is there for keeps. If we need to use a lot of medication, I don't know. But it's always going to be a fallback for your brain when things goes rough. And we can't. If you've triggered the bipolar, if you've triggered the anxiety, we don't have a way back. It's like if you step over that line, you've stepped over that line. Any other questions?
Yeah. Hi. You know, we've got many patients who, when they come in, they don't know they're psychotic. So you and Dr. Bula give them meds, stabilize them, and then we take over to do the rehabilitation. And many, many young people minimize the effects of marijuana. And they often say to us, I think every intake, at least 40%, 60% say, well, I'll stay off the drugs, I'll stay off the alcohol, but weed is my thing. It's either my culture, it is either my cozy blanket, it's something that my family use, it's decriminalized. And we really struggle because they didn't know that their psychosis was triggered by the marijuana. It might very well have unleashed their bipolar and their schizophrenia and all the other mental health conditions, but they don't know that they were sick. So how do we work with them to get them to understand?
This is the most difficult thing of all, because your brain protects you from the knowledge of psychosis. Because if you had to realize exactly how sick you were, your brain cannot manage that. So you do not remember the amount of psychosis, about the amount of illness. Sometimes it helps to get the family to tell you exactly how sick you were, or the staff, but most people don't believe us. They just don't. And it's the biggest problem in psychiatry, is if somebody comes in and they're psychotic and they just don't believe us. I sometimes go back and I read to the patient word for word what they said to me. And then I would go like, yeah, I don't know what I did. I don't know why. And that's the problem, is that, but let's talk a bit more about psychosis. I wanted to the other time and I didn't. Psychosis has 2 or 3 definitions. The one is a problem with salience. Now, salience is how you experience the world around you, and what it means to you. So a severe problem with salience will hear an air conditioner and think that it's the ocean, and they'll believe it's the ocean. A little bit of salience problem would hear the aircon and think, that sounds like the ocean. And if you not have any problem with salience, you will know it's the aircon. The little bit of salience where you think, that does sound like the ocean, that's enough already to be on the way to psychosis. So that's the one way of looking at psychosis. The other way of psychosis is it's a formal thought disorder. And this is a very difficult one. If I have to explain to you formal thought disorder, I'll do it this way. I'll say, what did I have for breakfast? Well, I had egg and tomato. So if I have psychosis, but I have circumstantial psychosis, I will say, you know what? I got up and showered. I couldn't find a shirt I really liked. And then I had an egg. And you know what? There was also tomato on the plate. And if I have tangential psychosis, I will go, you know what? I got up and I wanted to eat, but then I started working. And you know what? That chair of mine is just not sitting comfortable enough. If I have a loosening of association, I would go, I had eggs. You know, egg yolk is quite a dark yellow. I like dark blue. Blue is very interesting. Or psychosis is where you hear and see things. It is not only when you hear and see things. These other places is also part of psychosis. It is when your brain does not take the straight road from A to B. Now, I have to tell you, it's a very difficult thing to see and to understand. When I started studying psychiatry, it took me 2 years from just sitting there and listening before it clicked into my head what psychosis is. So if it takes somebody that's not psychotic 2 years to understand psychosis fully, to explain it to somebody that's psychotic is almost impossible. It often helps if you trust somebody, if they can tell you what happened. But you also need to realize that if somebody say you're psychotic and they are professional, they probably know what they're talking about. It's a difficult one. You know, it's easy if I say it's just when you hear things or see things. It's not that easy. Psychosis is also not only looked into drug abuse or only into schizophrenia or only into bipolar or only into depression. All of them can give you a psychotic thing. All psychosis, however, need to be treated with an antipsychotic. We've got some nice medications currently. Most of the patients will be a lot less psychotic within 4 days, almost no psychosis within 10 days. And then they sit there and they said, why must I take the medication? And I just go, if you don't, your brain's going to fall back in psychosis. And if your brain falls back in psychosis, you're going to cause more damage. And that's what we're sitting with.
I think, addiction and mental health are the two illnesses that convince you that you're fine and you don't have them.
Yeah.
And, we hear it the most. You were talking about the psychiatrist not touching marijuana. When we get asked, what's the worst drug on the planet? I have 2 answers. I always say to the person, the drug that you are using. And then if you ask my professional opinion, for me, it's marijuana. Because there's so much culture and so much enmeshment and so much passion. And it is the one drug that will literally change your brain as we're watching it. And the person smoking it thinks they're fine. Heroin addicts know they love heroin. They'll tell you, I'll sleep on the streets. I will rob your grandmother. I will steal your shoes. They have no problem. Marijuana addict comes in and he's little Kim. Like, that's the paranoia, psychosis that we deal with. We've had more Elon Musks in rehab than Elon Musk has had thoughts of the next project he's working on. And that's the marijuana psychosis.
And queens.
Yeah. Yeah.
And kings.
Little Wayne, I think he's the most talked about rapper in rehabs. Are there any more questions? We can't see the Northcliff population or the farm population, but I'm sure there's more questions or statements you have for Dr. Thea.
Hi, Dr. Thea, it's Clive here.
Hi, Clive.
Dr. Thea, with marijuana, a person can present and arrive here in a cannabinoidal psychosis, okay? First time. And this is what's scary, is if they pick up that marijuana again, does the psychosis get actually longer and worse? And what are the impacts of that?
Every time you're psychotic, your brain gets damaged more and more. And the psychosis depends on how much of the cannabinoid, the psychotic cannabinoids was in your soul. So it doesn't always get worse, but the brain damage gets worse each and every single time. Normally, because your brain damage are worse, you have a smaller chance of getting back to normal.
Hey, Dr. Thea, it's Aaron's again.
Yes,
got
Aaron.
a question with coke. From what I knew before coming to rehab, that meth is the only stimulant that can cause permanent brain damage to your dopamine receptors. But I wanted to know,
what's the difference between cat and coke, cat and meth?
Isn't coke like a reuptake inhibitor, and meth just releases a shit ton of dopamine?
No, but when you make them, what's the difference between when you make them?
I have no
An
idea. I don't
hour
know
of
how to make
cooking.
those.
An hour of cooking. So every single
Between-
piece of cat has some meth in them because it's an hour
No,
of
but this
cooking
is-
longer.
No, I wasn't talking about cats. I was talking about cocaine.
Okay. But I'm telling you about
does
cat. So
cocaine-
cat definitely also does the same thing. Coke has been proven to
Okay.
cause dementia, hey?
Dementia as well. And any like irreparable brain damage?
Dementia is irreparable brain damage.
Okay. And MDMA also?
In DMA, we don't have full results, no. We don't know if it's permanent or not. We don't.
So, Ernst,
And then, yeah,
could you tell us, if you were to pick up a drug after you leave rehab, what would it be?
mushrooms.
Reasoning?
Yes, mushrooms. the
What would your
Amazonian
reason
one.
be? Oh,
What would my reason be for relapsing?
using, and choosing that particular, what would your reasoning, and I use my words carefully, reasoning.
For relapse? Why would it be mushrooms? Because Dr. Thea says it doesn't cause psychosis and complete brain damage. The safest option as far as I know.
All right, so if I may use you as an example for a minute, and it's not personal, because that's how the mind of an addict works. We can hear all of this, we'll get all the scientific proof, and we'll try and find the one that will cause the least amount of damage. And we go on a trip, go on a mushroom trip, and it's very nice, and you do it once a month. Do we actually believe we're going to stay clean? Because we may not have taken our drug of choice. We may not have, woken up the dopamine or the neurotransmitters. But do we really believe that we can use something like mushrooms once or twice and stay in recovery?
My answer would be no. No, because you're still using a mind-altering substance. But also with mushrooms, like, it's not just gonna stay once a month. You're gonna want more of an escape because we can't use anything as an escape anymore, in my opinion.
Yeah. You see, you might use the pornography, but that's also damaging, you know. So you might try to say, you know, that's not damaging, but you know how much it damage relationships, damage your feelings about yourself. So, you know, even the ones that doesn't physically causes damage, does cause damage emotionally and does cause damage in our relationships.
Yeah, I know. Yeah, it's understood from our side.
A harsh
Terrible
reality, I
addiction.
think, of what we sorry, Ernst. The harsh reality that we have to live with is that if we have the disease of addiction, we can reason, rationale, test, try, debate, but the only real hurt we cause is ourselves and our immediate families and loved ones. If drugs were made for fun, it would be a different story. If alcohol was made not to change our brain chemistry so that we drink more, we wouldn't have half the problems we have. Coming to terms with the disease of addiction, then we recognize it doesn't matter what drug we use. And my concern, as somebody who's been around for a long time, is that the drug that you make okay is the one you'll probably relapse on. And that will be the worst drug for you. And a lot of our youth don't see alcohol and marijuana as a huge problem. A lot of the ladies don't see tablets as a huge problem. You know, a lot of people will say, okay, I'll stay clean and sober, but if I get a headache, I'm taking codeine. I'm still waiting to see the day people can use drugs successfully. I'll sell that model far quicker.
And I just want to say one thing. The next person of you guys in this group that tells me I only used beer or spins or fruit drinks, I have to tell you, those are the most dangerous of all the alcohols. Hardtack is not the dangerous part of alcohol. The soft ones are.
Dr. Thea, my name is Tristan. Does mushrooms not bring up anxiety in people? So
yeah, it does bring anxiety. It does bring anxiety.
Does it affect your body in somewhat of a way anyway, right?
It does affect your brain. It does affect your body, definitely.
Okay, and then my next question
it's just not a long-term problem. They think at this moment, but they might change. But at this moment.
Thank you. My next question is with a meth psychosis and then a marijuana psychosis, like by what you're saying is marijuana psychosis more damaging to the brain than a meth psychosis?
Yeah, for two reasons. A meth psychosis, meth is in your body for 2 to 3 days. So the psychosis is often just a week or two. Dacha is in your body for up to 40 days. So the psychosis is often a lot longer. And because it's longer, it causes more damage. Both causes damage, but the Dacha significantly cause more damage.
Hi, Dr. Thea. It's Merwe here.
Yes.
I had a question about the other addictions like gambling, sex, pornography, like you mentioned, and anything else like that. Can that give you dementia?
Yes, it does. Because the dopamine system doesn't work the way it should. So if you've used it enough times and you've enough times relapsed on that dopaminergic system, doesn't matter if it's due to pornography or whatever, you can get damage, yes. Also, you know, a sex addiction can very easily give you some sexually transmitted diseases, which is quite damaging, I think. Gambling can make you poor. So there's other stuff around it as well that is problematic. But it does definitely causes damage to the dopaminergic system. So yeah.
You raised an important point. We've got to recognize addiction is a biopsychosocial illness. It's got one element is in the brain, the other element is in our emotions and in our behavior and in our society. So, you know, you were talking about the cocaine earlier. The coke and crack psychosis it's not pretty when people come in, but the heart damage and the heart attacks and heart failure associated with crack and coke is extremely high. and the damage to the muscles around the heart. So we'll say, okay, well, I don't want to become psychotic, but we don't really look at the fact, well, we might be damaging our kidneys, our heart, which is also irreparable.
Our lungs, like the dagga that gives you COPD, the tobacco that gives it to you. Yeah. In my next universe, I'm going to have a tobacco addiction rehab. I don't think I'm going to manage to get a lot of successes there. No,
no, you won't be full with patience.
But yeah, everything does causes problems long term. And I mean, it does definitely causes an abnormality in your dopaminergic system. And that long term does give you a higher risk for dementia. So it also does have an influence. It's not as severe as the others, but it's definitely also there.
Yeah, we've got a question here regarding sugar addiction.
Same thing.
Dopamine.
Same thing.
Also dopamine.
Mhm.
Because most of us addicts, once we put down the drugs, we pick up a lot of sweets
The
and
sugar.
candy. Yes.
Here's something that, remember when you saw that first video that I showed you? She's like, it takes with time, she will get better. And it's the same here, that with time, you won't crave as much sugar anymore. So initially you will, but with time you won't. So what is that time span? It's about a year. So lots of people that stops meth, coke, crack, etc., picks up weight in the first few months, and then they lose it after about 6 to 8 months. So the people come and they tell me, yeah, it's your drugs. No, even if I gave you no drugs, but you stopped your cat, your coke, your meth, you will pick up because your metabolic stuff is not working like it should. But if you stop, and in about 6 months or 8 months, those metabolic systems will recover. They're luckily one of the few things that recovers quickly, and then you'll lose the weight. So people do pick up the weight, but they do lose it as well.
Hello, Dr. Thea, it's Sarah.
Hi,
Dr.
Sarah.
Thea, I wanted to know if tobacco is also a drug, right, and it releases dopamine, and our brains are recovering from all the things that release dopamine, external things. How are they recovering if we're still smoking cigarettes?
Cigarettes, if you're smoking cigarettes, you have a 5.7% higher chance of getting dementia. So it's not leaving your brain out. It's still there. For interest's sake, the one thing that I didn't know at all is if you're deaf and you don't have hearing aids, it increases your dementia risk with 20%. That sort of like got me for a fly. But tobacco also increases your risk of dementia. So it's not that you jump at 3 and it's not the same. You have the same risk. Or not the same risk, you also have a risk. Anything else?
Team, Brian, is there anything else from either of your side?
There are no other questions aside.
Guys, anyone with a question? Last question, maybe? No. No questions from this side.
Thank you. Thank you.
Thanks,
Thanks,
doctor.
doctor. Thank you.
Take care.
Bye.
Bye. Oh, hello.
We need to stop recording, and I can't.
How the hell do I do that?
I think we have to do it off theirs. I'll call you.
You should be able to do it now.